Good evening, everyone. So, my next video, which I'm going to discuss with you, is on the topic uses of neostigmine, which is the reversible anticholinesterase inhibitor, and which is water soluble drug. I'm going to discuss with you the uses of neostigmine. And before I start my video, I want to request you if you like this video and if it is so useful to you and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. And now I'm discussing with you the uses of neostigmine. And neostigmine, as I have already told you, it is the water-soluble drug, and it is the quaternary amine, and it does not cross the blood-brain barrier, GAT or I. It acts on the periphery or the neuromuscular junction, so it can be used as a treatment of the myasthenia gravis. Myasthenia gravis is a disease in which there is muscle weakness, and this muscle weakness is due to formation of antibodies against nicotinic receptors in the neuromuscular junction. As the antibodies develop against the nicotinic receptors, such as NM receptors, the action of acetylcholine does not come. And thus, we can give the neostigmine, which is the reversible acetylcholinesterase inhibitor, which will inhibit the breakdown of acetylcholine, and it will increase the levels of acetylcholine in the body, and the action of the acetylcholine will come in the neuromuscular junction, and there can be muscle contraction can occur. So it can be used in myasthenia gravis. It can be used in the treatment of the myasthenia gravis. And this in our body, there is a muscle weakness, and when there is when there is excess of the acetylcholine is there in our body, action of the excess of acetylcholine in the neuromuscular junction, it can lead to cholinergic crisis. Means that can also lead to muscle weakness. So there are two types of the muscle weakness, either due to excess of acetylcholine, and which is cholinergic crisis, and either due to lack of the acetylcholine action, which is the blockade of the neuromuscular junction, blockade of the nicotinic NM receptors, that is due to myasthenia gravis. And to uh, diagnose this, that is the muscle weakness is due to cholinergic crisis or it is due to myasthenia gravis, we have the drug adrofonium, which is the shorter acting drug, which its action is less than 10 minutes, and we can give this drug. And if there is this is the adrofonium, which is again the reversible anticholinesterase acetylcholinesterase inhibitor. When we give this drug, if there is improvement in the crisis, means in the improvement in the muscle weakness is there, we can say that the muscle weakness was due to myasthenia gravis, because we this muscle weakness is due to lack of the acetylcholine, was due to lack of the acetylcholine. So if we give the hydrofonium and if there is improvement in the muscle weakness, that we can say that this is due to myasthenia gravis. The muscle weakness was due to myasthenia gravis. And if there is worsening of the weakness, if we give acetylcholine and there is worsening of the muscle weakness, that tells us that that is due to cholinergic crisis, because there was cholinergic crisis. Now this is the difference, and now I'm going to discuss with you the myasthenia gravis treatment. Myasthenia gravis treatment can be the neostigmine or the pyridostigmine. Pyridostigmine is the longer acting drug, and it can be used in the treatment of myasthenia gravis. And next drug is the this neostigmine. It can act in the NM receptors, plus it can act in the M1, M2, M3 receptors also. So in the myasthenia gravis, when neostigmine acts on the M1, M2, M3 receptors, there is increase in the levels of acetylcholine in the body due to action of acetylcholine in these muscarinic receptors also. Plus in the nicotinic NM receptors also, there is increase in the action in the body. And we have to give atropine, which is the anticholinergic drug, which acts at the anti-muscarinic sites to treat the symptoms, the side effects of the stimulation of the muscarinic receptors. Means M1 receptor stimulation will lead to gastric acidity, M2 receptor stimulation will lead to bradycardia, M3 receptor stimulation will lead to increase in intestinal contractions leading to diarrhea and increase in urinary flow leading to urination. So these symptoms can be prevented by giving atropine along with the neostigmine. So next use of the neostigmine, which I'm going to discuss with you, is the cobra bite. Cobra bite is the in the cobra bite, the venom, it attacks the neuromuscular junction and it blocks the NM receptors. Again, NM receptors are blocked, and we have to give neostigmine plus atropine, as it is the reversible anticholinesterase acetylcholinesterase inhibitor. Neostigmine, it will increase the levels of the acetylcholine in the NM junction. Plus, as it acts on the M1, M2, M3 receptors also. So we can have to give atropine to treat those symptoms. And thirdly, that is the symptoms of gastric acidity, bradycardia, urination, diarrhea. And thirdly, the next use is in the neostigmine is in the post-operative paralytic ileus. Because when in the surgery, when there's abdominal surgery has been done post-operatively, the ileum, it gets relaxed. It remains relaxed for a long period of time, even after the surgery has been stopped. So we have to stimulate the ileum by giving the drug which will stimulate the M3 receptors. Means M3 receptors are stimulated by increasing the levels of acetylcholine in the body by giving neostigmine. So these are the acetylcholinesterase uh, inhibitors, and they will inhibit the breakdown of acetylcholine in the body, and it will lead to increase in the levels of acetylcholine. Thus, there will be action on the M3 receptors. So these can be used in postoperative paralytic areas. Fourthly, these can be used in the treatment of postoperative urinary retention. In the urinary retention is again when there is urinary retention after surgery, we can stimulate the M3 receptors by giving neostigmine, and they will stimulate M3 receptors that will lead to urination. And in this postoperative paralytic ileus and postoperative urinary retention, we have to give alone neostigmine. There is no need to give atropine with these, because atropine, it blocks the muscarinic receptors, but we have to stimulate the M3 receptors. So atropine use is not there. The fourth-fifth use of neostigmine is in the reversal of non-depolarizing muscle relaxants. In the anesthesia, when we give the general anesthesia during the operation, this non-depolarizing muscle relaxants like atropurium, pancuronium can be given to produce muscle relaxation. And this muscle relaxation is produced, has to be produced in the body for a period of half hour or 1 hour or 1.5 hours. But when we give this drug like pancuronium or atropurium, it produces the this muscle relaxation for a longer period. Like it can produce the relaxation for 6 hours, for 10 hours or 20 hours. So for the reversal of the non-depolarizing muscle relaxants, we give this drug that is neostigmine, that will act on the NM receptors, that is which block the NM receptors. That will act on the NM receptors, and they will lead to increase in the levels of acetylcholine, and acetylcholine will act on the NM receptors. So there will be contraction, muscle contraction will be there, and there will be no relaxation, and the patient it regains the muscle contraction, as the non-depressing muscle relaxants these act on the NM receptors and they block the NM receptors. These increase the levels of acetylcholine, these neostigmine, and it will lead to more muscle contraction after the surgery. So that's all for the uses of neostigmine. I hope you understood. And if you understood, kindly, I request you kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be wealthy, be safe, be happy. Thank you. Be blessed.